Senate will come to order. Mr. Schaffler, please call the roll.
Senators Amabile, Baisley, Ball, Bridges, Bright, Carson, Catlin, Cutter,
Excuse.
Danielson,
Excused.
Doherty, Exum, Frizzell, Gonzalez, Hendrickson,
Excused.
Judah, Kip, Kirkmeyer, Colker, Liston, Lundeen, Marchman, Michelson-Genet, Mullica, Pelton B, Pelton R, Rich, Roberts, Rodriguez, Simpson, Snyder, Sullivan, Wallace, Weissman, Winter, Cutter, Hendrickson, Mr. President.
Let's do this. The morning roll call is 34 present, 0 absent, 1 excused. We have a quorum. Senator Ball, will you please lead us in the Pledge of Allegiance?
Please rise and join me in reciting the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Approval of the journal. Senator Frizzell.
Good morning, Mr. President. I move that the Senate Journal of March 25th, 2025 be approved as corrected by the Secretary.
You've heard the motion. All those in favor say aye. Aye. Opposed, no. The ayes have it, and that motion is adopted. Senate Services.
Correctly printed, Senate Bill 205. Correctly engrossed, Senate Bill 71 and 124. Correctly re-engrossed, Senate Bill 9 and 191. Correctly revised, House Bill 1085, 1086, 1090, 1109, 1124, 1137, and 1203. Correctly re-revised, House Bill 1007, 1024, 1110, 1133, 1179, 1205, and 1238. Correctly enrolled, Senate Bill 14, 23, and 51.
Committee reports.
Committee on Appropriations. After consideration on the merits, the committee recommends the following. House Bill 1005 be referred to the Committee of the Whole with favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 184 be referred to the Committee of the Whole with a favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 177 be referred to the Committee of the Whole with favorable recommendation and with a recommendation that it be placed on the consent calendar. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 176 be referred to the Committee of the Whole with favorable recommendation and with the recommendation that it be placed on the consent calendar. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 175 be referred to the Committee of the Whole with favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 174 be referred to the Committee of the Whole with favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 41 be amended as follows, and as so amended be referred to the Committee of the Whole with favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 20 be referred to the Committee of the Whole with a favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 2 be amended as followed, and as so amended be referred to the Committee of the Whole with a favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 1 be amended as followed, and as so amended, be referred to the Committee of the Whole with favorable recommendation. Committee on Appropriations. After consideration on the merits, the committee recommends the following. Senate Bill 49 be referred to the Committee of the Whole with favorable recommendation.
Third reading of bills. Consent calendar. Mr. Schaffler, please read the titles of all the bills on the consent calendar.
House Bill 1086 by Representatives Barone and Gonzalez and Senators Pelton B. and Michelson Janae concerning the timing of the enactment of the Interstate Compact on Placement of Children. House Bill 1085 by Representative Lukens and Johnson and Senator Roberts and Pelton R. concerning public hospital boards of trustees. House Bill 1203 by Representatives Winter and McCormick and Senators Pelton R. and Mullica concerning cell-cultivated meat and in connection therewith prohibiting the misbranding of cell-cultivated meat as a meat product and requiring cell-cultivated meat to be clearly labeled as cell-cultivated meat.
Majority Leader Rodriguez.
Thank you, Mr. President. I move for the passage of all the bills on third reading of bills, final passage consent calendar, which are House Bill 1086, House Bill 1085, and House Bill 1203.
Is there any discussion on any of the bills? Seeing none, the motion is the passage of all the bills on third reading of the bills consent calendar. Are there any no votes? Seeing none, with a vote of 34 ayes, 0 no, 0 absent, and 1 excused, House Bill 1086 is passed. Co-sponsors. For House Bill 1086, Senator Kipp, Senator Cutter, Judah, Snyder, with a vote of 34 ayes, 0 no, 0 absent, 1 excused, House Bill 1085 is passed. Co-sponsors, Senators Pelton B., Carson, Catlin, Mr. Majority Leader. With a vote of 34 ayes, 0 no, 0 absent, 1 excused, House Bill 1203 is passed. Co-sponsors, Senators Roberts, Pelton B., Simpson, Carson, Exum, Catlin, Mr. Minority Leader. For cell-cultivated meat, no one else. Per Senator Sullivan's request, please add the president. What did I co-sponsor? Third reading of bills. Final passage. Mr. Schaffler, please read the title of Senate Bill 124.
Senate Bill 124 by Senators Kirkmeyer and Gonzalez and Representatives Brown and Garcia-Sander concerning outpatient drugs that are sold at a discount to nonprofit hospitals through the federal 340B drug pricing program.
Senator Gonzalez.
Thank you. Mr. President, colleagues, we move Senate Bill 124 on third reading and final passage.
Any discussion? There is discussion. Senator Mullica.
Thank you, Mr. President, and I want to start off by offering a sincere thank you to the sponsors. And we had some debate yesterday, and I genuinely feel like the sponsors are running this bill because they do care about Colorado and because they do want to help patients. And so I want to make sure that I recognize that. I do think that there are going to be consequences, unintended or intended, that come out of 124, though. When we look at the 340B program, it's obviously not something that when we all go knock on doors or have town halls that we hear about at our town halls, but it actually does have a huge impact on the care that the people of Colorado get. And I think that when I look at 124, and we had this discussion yesterday, I'm really concerned about the environment of our healthcare system in our country. We talked yesterday about the budgetary issues that we're facing as a state and the cuts that we're going to have to make as a state. And part of those cuts are looking at our Medicaid program. In addition to that, we're also looking down the pipeline at $880 billion in cuts to Medicaid, which are catastrophic. That creates an unstable environment. That's our baseline. Right now, it is an unstable environment. And what we're looking at in 124 is we're saying, okay, we're going to talk about transparency, and we're going to want to make sure that the dollars from the 340B program are being utilized in the correct way for our hospitals. But when you go and talk to the hospitals, you hear about how some of this is not possible. But even more importantly to that, if you look at the back of the bill, you can look at how this can lead to significant litigation as well. We have our hospital systems who are telling us that this is an unstable environment. We have our hospitals telling us that they are worried about care being lost for our most vulnerable patients in Colorado. We hear from parts of our state that are having maternal health care deserts. We as a state should not be adding to that problem. We as a state should not be making it harder for our hospitals to operate. When we look at how these 340B dollars are being spent, let's look at the charity care. Let's look at the $94 million in charity care that St. Anthony Hospital has provided, or the $700 million in uncompensated care that UC Health is offering. Or let's talk about how these hospitals are providing liver transplants to Medicaid patients and wouldn't be able to do that without these 340B dollars. Because I'm going to tell you what's going to happen, members. If we have hospitals that start closing down because of this unstable environment, if we have hospitals and clinics that aren't able to offer these services because trial lawyers have found a way to find another way to bring litigation into the system, these patients are going to not get the care they need. They're going to delay the care, actually. And we're talking about an unstable environment, and we're talking about how our budgetary constraints are in a difficult spot. Well, let's talk about what it's going to do to our budget when these patients delay their care and they end up in the ER, and they're sicker, and they end up being admitted to the hospital. We can talk about how much money that costs and what that's going to mean to the system. And I think that's really what I'm concerned about. I think we should have conversations. I think that we should try to make sure our healthcare system is the best that it can be. I think that we should have difficult conversations about what it looks like for accountability. But that's what we're doing with this bill, is we're focusing and saying we have a system that's broken at the federal level, and so we're going to come down to the state level, and we're going to make the hospitals in Colorado operate differently than all the other hospitals throughout the country. And in an unstable environment, we are going to create even more hoops and even more possible litigation for these hospitals. And that's concerning, and I think we should all be concerned about that. And that is why I'm down here asking you to be a no on Senate Bill 124. Because we need to do all that we can right now as a state to be circling our wagons. We don't know what's coming. We don't know what it's going to look like. And this is the same, look, members, this is the same conversation I've had with the healthcare ecosystem as a whole. The healthcare ecosystem should be circling their wagons. With all the unknowns that we have coming and all the risks that we have coming, we need to make sure that we're doing all that we can to protect the people of Colorado. We need to make sure that we're doing all that we can to make sure that we are not adding to a problem, that we are not going to increase the risk of clinics closing, increase the risk of hospitals closing. And look, I'm sure people on the other side of the glass are saying, Mullica is being theatric, Mullica is being dramatic. I work there, though. I actually work in the ER. I'm not down here for any other reason other than to make sure that we're fighting for our patients and that we're making sure that that care is available to our most vulnerable patients. I'm not here trying to enrich the pharmaceutical industry. I'm not here to try to enrich any industry. I'm here to make sure that what we do in this building doesn't have a negative impact on the patients that I take care of. And I'm telling you right now, I'm raising an alarm saying this bill right here before us scares me. It scares me because of the impacts that it potentially can have on the ability to care for our most vulnerable people in Colorado. So I will say it again, I do appreciate the conversation that these sponsors have started. I appreciate the work that they've done because I know that they probably have the same goal that I do, and they care about the people of Colorado. But I do have concerns when it comes to Senate Bill 124, and I would ask for a no vote.
Further discussion. Senator Michelson Janae.
Thank you, Mr. President. I feel like it's incumbent upon me to come down and tell you why I'm a no on SB 124. And just hear me out. SB 124 will severely restrict the 340B program, threatening the $700 million currently available for charity care, including cancer treatment and life-saving specialty care only available through larger hospitals. This will cause widening health inequities, reduced resources for charity care, infeasible administrative burdens, and pushing out critical contract pharmacies. The helpful and achievable parts of SB 124, and there are helpful and achievable parts of SB 124, have been amended into SB 71. As amended, SB 71 increases transparency more than any state in the country and prohibits inappropriate use of 340B savings, things we took directly from SB 124. This is ensuring that critical funds go to support patient care. The concern about SB 124 is that it's a backdoor to restricting the 340B program. The bill requires data that hospitals don't have. Hospitals don't have 340B data by payer, so requiring reporting to be disaggregated by payer is not feasible. Manufacturers and PBMs would be in the best position to provide this information. The bill would push contract pharmacies out of the 340B program, reducing patient access. All contracts would need to be renegotiated with major changes, and this would drive many partners to not participate in the 340B program at all. Contract pharmacies are essential for patients who otherwise would have to drive long distances to get to their prescriptions, or worse, may not be able to access them at all. SB 124 would limit access for low-income patients to life-saving, highly specialized care. The large hospital systems impacted by the bill provide high-quality, highly specialized care, often not available anywhere else and often not covered by Medicaid. Examples include University Hospital is the only Medicaid transplant center in Colorado. Medicaid reimbursement is far less than the cost of care for life-saving transplants, often not even covering the cost of the organ itself. 340B savings are essential to fill this gap. Medicaid is often 6 or more months delayed in approving reimbursements for drugs newly FDA approved. 340B savings allow patients to access these drugs immediately when time is of the essence. For example, young adult patients with a degenerative eye disease were able to access a new drug that prevents blindness. Patients with melanoma were able to receive a new effective drug that restores hope against this aggressive condition. These are important components of why I am a no on SB 125. On 124, thank you. I think if we think carefully about the process, I left a piece of paper at my desk, hold on. I think if we think about the elements of 124 and what it is trying to do, we can see this shrinking of the process. There's also been a claim that SB 71 will raise costs for union health plans and Colorado state employee plans because they won't get rebates on 340B drugs. Drug companies don't know when 340B drugs are billed to private insurance plans. A Colorado law passed in 2022 prevents those insurance plans from treating 340B drugs differently or requiring pharmacies to identify 340B drugs. Manufacturers would only possibly stop paying rebates for all pharmacies or if they pressure pharmacy benefit managers to break the law prohibiting identification of 340B drugs to private insurance plans. The other concern of double dipping, federal laws prevent double dipping, paying rebates on 340B drugs, which raises costs for union health plans and the Colorado State Employee Plan. That's the claim. Double dipping rules apply only to Medicaid, not to commercial insurance plans like union and state employee plans. Congress intended for 340B drugs to be treated the same as other drugs in these cases, allowing hospitals to use the savings to offset the cost of Medicaid and uninsured care. In 2022, Colorado's nonprofit hospitals provided over $2.42 billion in community benefits, which is 3 times more than the savings from 340B. $2.42 billion, 3 times more than the savings from 340B. The purpose of the 340B program was never to give direct discounts to patients, but to strengthen the safety net for communities. And what are communities? Communities are our patients. 340B is not a patient discount program. It supports the healthcare system that treats everyone, regardless of their ability to pay. This reduces overall costs by ensuring access to care, and the cost of uncompensated care in Colorado far exceeds any 340B savings. I ask you to think seriously before you vote for 124 and limit the amount of 340B savings that are available to our patients in Colorado.
Further discussion? Senator Kirkmeyer.
Thank you, Mr. President, and good morning.
Good morning.
I think we've all heard a lot about the 340B program. So I'm not going to go on very long, but I would say I'm just a little bit confused by the good senator from Thornton's comments, who also is the chair of the Health and Human Services Committee. I'm thinking the portion of the bill that he was making some comments about was the transparency piece, which he tried to amend into Senate Bill 71. So that's why I'm a little confused. It was good enough to try for an amendment, but apparently today it's not. I had this analogy the other day when I spoke about this bill, and I'm just going to repeat it. You know, the food stamp program, SNAP. We wouldn't just give all the money to the grocery stores and then say, hey, go make sure you get that to the patients, or go make sure you get that to the people who need food. We wouldn't do that. This bill's pretty simple. It's about transparency. Just tell us how much you're making off of the discount drugs, and let's make sure that it's going back into the communities and back into the patients. That's it. That is pretty much it. That, and what the heck? We made sure that our small rural hospitals, critical access hospitals, our sole community provider hospitals, they're exempted out of this bill. And on top of it all, we put in a provision that says pharma can't restrict drugs to those hospitals. They can't restrict drugs. We put that provision in. That was extremely important because I'm telling you what, I'm sitting at the JBC and I'm trying to get Medicaid provider rates increased. Not kept flat, I'm trying to get them increased. So I'm pretty sure we're all sitting here worried about our hospital and our healthcare infrastructure system throughout the state. This bill is not a negative impact to it. This bill just says, tell us where you're making your profits. Let's make sure it's getting back to the communities. We'd love to trust you, but just tell us. That's it. So I would urge an aye vote on 124. Thank you.
Senator Gonzalez.
Thank you, Mr. President. Colleagues, I want to extend my gratitude to each of you for your thoughtful consideration of this policy, of the policy that we will consider immediately following Senate Bill 124, Senate Bill 71. I do want to thank the broad coalition of patients, of organizations that serve marginalized communities for their efforts to ensure that when we are talking about profits or savings, that when we talk about community benefits, that we don't just throw around big numbers, that we actually drill down into the specifics, that we drill down into the nuance. Because if I can't tell whether a diabetes screening at a community festival or actual care being provided to a long-term lupus patient or an AIDS patient, that work demands us as legislators to dig in, to look for that data. To the senator from Thornton's comments around we would be the only state enacting these transparency measures, I'd invite you to review Minnesota, because they are actually doing the transparency requirements set forward under Senate Bill 124. Now, I want to thank Labor for your strong support, because we know that at the end of the day, details matter, nuance matters. My last point that I will say is this. I think as a process, we all ought to sit and reflect. Because quite frankly, had we had another day, another week, I genuinely think that we could have gotten to a deal and figured this out. Be that what it may, here we are today. I'm proud of the work that we have done, and I ask for your support. I ask for an aye vote on Senate Bill 124. Thank you.
Thank you.
Further discussion? Seeing none, the motion is the passage of Senate Bill 124. Are there any no votes? Senators Roberts, Doherty, Mullica, Pelton R., Amabile, Catlin, Baisley, Rich, Sullivan, Ball, Cutter, Henriksen, Michelson, Janae. Please add the president. With a vote of 20 ayes, 14 noes, 0 absent, 1 excused, Senate Bill 124 is passed. Co-sponsors. Mr. Schaffler, please read the title of Senate Bill 71.
Senate Bill 71 by Senators Michelson, Janae, and Rich, and Representatives Martinez and Taggart concerning certain practices by persons participating in the supply chain of drugs purchased under the federal 340B drug pricing program.
Senator Rich.
Thank you, Mr. President. I move Senate Bill 25071 on final reading or final passage.
Discussion.
Go ahead.
Senator Rich.
Thank you, Mr. President. Of course, we talked about this bill yesterday, and I just wanted to take a moment to express my appreciation for everyone that has put up with the last, 3 months having to hear about this bill on the other side of that glass. But I do want to point out that I appreciate the words from the senator from Thornton, the good senator from Thornton, because regardless of how many things got exempted out of the previous bill, the Colorado Rural Hospital Association still opposes that bill for the reasons that he pointed out. This bill, as I mentioned yesterday, and I'm talking about one of my hospitals, they don't fit under the rural definition, and they don't fit under the critical care, but they employ 1,400 people. And there is a real chance that if this bill doesn't pass, that could shutter, which starts to hurt not only hospital care for patients, but 1,400 jobs get lost as well. So without continuing to repeat what we said yesterday, I'm asking for an aye vote on Senate Bill 71.
Further discussion. Senator Gonzalez.
Thank you, Mr. President.
I'd like to read a letter from an organization that for decades has served the people at margins, working class, people of color, Servicios de la Raza. Esteemed members of the Colorado General Assembly, Servicios de la Raza respectfully submits this letter to express our strong opposition to Senate Bill 25071. While the bill purports to safeguard access to discounted medication through the 340B drug pricing program, we are deeply concerned that its provisions will perpetuate longstanding patterns of abuse by certain hospitals and health systems at the direct expense of our communities. 340B program was originally designed to help healthcare providers serving low-income and uninsured populations by allowing them to purchase outpatient drugs at discounted rates. However, extensive documentation from the Government Accountability Office, the Officer of Inspector General, independent studies, and numerous media reports has revealed that some hospitals exploit this program to generate profits without passing the savings on to patients. These practices have disproportionately harmed low-income and minority communities, including African American and Latino populations who already face systemic barriers to accessing affordable health care. Knowing my good friend Rudy, he goes on, I will save you that. However, I will close. Therefore, we urge you to vote no on Senate Bill 25071 and instead support legislation that promotes greater transparency, accountability, and equitable distribution of 340B savings. Our communities deserve healthcare policies that genuinely improve access to affordable medications and reduce health disparities, not measures that enable continued exploitation at our expense. Thank you for your attention to this critical issue. Sincerely, Rudy Gonzalez, President and CEO. I will also acknowledge and express my gratitude to Honorable Elbra Wedgeworth, Rudy Gonzalez, Khadijah Haynes, Bianca Emerson, James Roy II, Nita Gonzalez, Quan Atlas, and Kevin Marchman, who all who have joined efforts in order to save 340B, who are asking to vote no on this bill. Thank you, Mr. President.
You got it. Senator Kolker.
Thank you, Mr. President. Yesterday, I got up and spoke about this bill, spoke on this bill, and spoke actually to both of the bills, but used the time that this bill was being presented. And I spoke to a handful of people still here in the room at the time, so I don't think all of you got to hear what I had to say. I may be one of those people that will be a yes on both of these bills, because I still think there's room for both of these bills to come together. The history for 340B became personal to me when I reached out to my sister-in-law, Kelly, who is one of the foremost experts in 340B in the country, which I did not know, because apparently I didn't pay much attention to what she did for a living. So my apologies, Kelly. But I knew she received her MBA. She was a pharmacist for a long time and got her MBA and went to work for a company. And in that company and the work she had done and what she was trying to explain to me over numerous Christmases, and still me trying to understand, was the work in analyzing 340B programs at hospitals and analyzing and doing reporting to make sure that they were more transparent. And so I asked her to look at both of these bills. And in both of these bills, she analyzed them and agreed with many of the things in both, especially the transparency part about making sure that the savings wasn't going to the C-suites, wasn't going to executive bonuses, that was going back into, the hospital and how they are used. She also helped me understand that 340Bs were intended, I think the original legislation was in 1992, to help rural hospitals, help hospitals who are helping underserved populations, helping hospitals that focus a lot on Medicaid. And understanding that, and then doing some research and looking at not just hospitals, because there's, I think, 68 hospitals in the state, but there are 900 related entities in this state. And some of those are school-based health centers. We heard about FQHCs, federally qualified health centers. So they're tied to these hospitals. And understanding that this program needs that transparency so that it can continue to help those underserved populations. And so I had talked to her about this and found out some more information, found out that Maine had passed a pretty good law and that states all across the country are looking into this right now and trying to figure this out. And seeing that we have two bills who are trying to do something to make this program better. And I want to thank the bill sponsors on both bills for their hard work on this, because this is not an easy task or an easy lift. Seeing what the first bill, this bill, Senate Bill 71, has done to add some transparency has made me more in favor of this bill. So if I was to weight my votes and rank my votes, my vote would be further weighted for this bill. But both bills are missing something that I know there's been talks about and very contentious discussion about, but based on information from Kelly, they're both missing something where hospitals are getting a bigger benefit and pharmaceuticals are getting a bigger benefit that we're not addressing, which is limiting the number of covered pharmacies, okay? Which is limiting the number of covered pharmacies in the 340B program. Unlimited numbers of pharmacies is a way for those hospitals and those the pharmaceutical companies to profit, even though they're nonprofits, to get more money out of it. I'm not going to go into the line-by-line explanation that she gave me of how it works. I'm just going to give you the 30,000-foot viewpoint. Now, the problem with limiting them is trying to figure out what is the proper number. Do you limit it by geography? Or do you limit it by number? Because when we talk about specialty drugs that are covered under this program, there are 10 pharmacies in this country that administer some of these specialty drugs in the country. So you can't really limit it by geography, but you do need to limit it by number, and coming up with that suitable number is something that I think is a harder lift. But it's something that I want both bill sponsors, as both bills, I believe, will be going forward to the House to consider. And I know that's throwing a wrench into this discussion. I know that you've worked on this previously, but that's something that, when it comes to 340Bs, must be considered going forward in any kind of reform. So I will be a yes vote, a heavy yes, on this bill today. Thank you.
Further discussion? Seeing no further discussion, the motion is the passage of Senate Bill 71. Are there any no votes? Senators Bright, Carson, Gonzalez, Kirkmeyer. With a vote of 30 ayes, 4 noes, 0 absent, and 1 excused, Senate Bill 71 is passed. Co-sponsors, Senators Roberts, Mullica, Pelton R., Colker, Amabile, Liston, Frizzell, Marchman, Snyder, Exum, please add the president. Mr. Schaffler, please read the title of House Bill 1090.
House Bill 1090 by Representatives Sirota and Ricks and Senators Weissman and Cutter concerning protections against deceptive pricing practices.
Senator Cutter.
Thank you, Mr. President. I move House Bill 251090 on third reading and final passage.
Further discussion, Senator Weissman.
Thank you, Mr. President. Members, I wanted to say just a few things as we undertake the final vote here. First, when we talk about fair pricing, honest communication into the marketplace, legally that's not remotely a new idea. The 1914 Federal Trade Commission Act said as follows: unfair methods of competition in commerce are hereby declared unlawful. You can find substantially the same statement in substantially the same place in statutes today, more than 100 years later. Now we call this a consumer protection bill. I will always continue to do that. But I want to underscore it's about more than that. It's about protecting the right kind of business activity, promoting honest businesses by discouraging the wrong kind of market activity. These two interests go together. That's in part why we heard supportive testimony from businesses in committee. Two, just as legally this is not a new idea, it is not factually a new idea either. In fact, I think straightforward communication about the cost of goods and services is the way that things have happened pretty much since, 1500 AD until very recently, if only because the technologies that now complicate or can complicate honest communication about pricing, frankly, didn't exist until relatively more recently. So the proposition that actors in the marketplace should sell whatever they want to sell at whatever price they want to set and just need to communicate that in a straightforward way is not a new proposition, and we don't think it's a hard bar to clear, again, because actors in the economy have been clearing it for years and centuries. Three, and just to underscore, we do need to act. You can research online and find estimates just casually, anywhere from $500 to $3,300 a year is the average cost to an American family of junk fees or hidden fees or covert fees, or call them what you want to. It's a pretty broad range, and that kind of testifies to the point. It's hard to pin down what's going on here. At least in my corner of the world, $500 is not a minor amount of money to a family in Aurora. That's a medical bill or fixing a car so you can get to work, or you know, getting a new fridge so your food doesn't rot. I want to share a story that I heard last week in talking to somebody who is supportive of this bill. So there's somebody who is a tenant, and they are obligated to pay rent, and they can do that, and they're obligated to pay utilities, and they can do that too. Except here's the problem. There's a junk fee attached to the utility payment. So this tenant has enough money to pay the utility payment, which is required by the lease, per usual. The landlord will not accept, I'm just going to make up some numbers, the landlord will not accept the $100 utility payment because the tenant doesn't also have the $25 junk fee that's attached to the utility payment. So now, for lack of the utility payment having been paid, although the tenant wanted to pay it, now the tenant is deemed to be in material breach of the lease, and there's going to be an eviction court proceeding before the end of the month. And remember, this is a situation where the tenant has the rent and wants to pay it, and has the utility amount and wants to pay it. What's actually happening in the state of Colorado. So, members, for all those reasons and more, this is still a necessary bill. It's less of a bill than we would like, but it is a necessary and helpful bill. It still declares misleading setting of prices that fall outside the lines the bill draws as deceptive, unfair, and unconscionable acts and practices, and that they are. And this whole thing still fits under our Consumer Protection Act, which is an appropriate place to put it. We need to keep talking about these issues. We need to keep standing up for people just trying to get by, trying to make ends meet, trying to have enough dollars to rub together at the end of the month to pay the bills and not get taken advantage of by this small number of businesses, the small percent of businesses that are trying to cut corners and just not do it the right way. So I'm asking for a yes vote.
Further discussion? Seeing none, the motion is the passage of House Bill 1090. Are there any no votes? Senators, Mr. Minority Leader Simpson, Frizzell, Pelton B., Kirkmeyer, Bright, Rich, Carson, Baisley, Pelton R., Liston, Catlin. With a vote of 22 ayes, 12 noes, 0 absent, 1 excused, House Bill 1090 is passed. Co-sponsors, Senators Sullivan, Wallace, Ball, Mr. Majority Leader, Gonzalez, Judah, Kipp, Henriksen, Winter, Michelson, Janae, Colker, Amabile, Exum. Please add the President. Mr. Schaffler, please read the title of House Bill 1124.
House Bill 1124 by Representatives Wyden and Senators Michelson, Janae, and Simpson concerning updates to the universal contracting provision requirements for the delivery of behavioral health safety net services.
Senator Simpson.
Thank you, Mr. President. I move House Bill 251124 on third reading and final passage and ask for your universal support of the universal contracting provision requirements of this bill.
Very good. Any other discussion? Seeing none, is there universal support or are there any no votes? Just waiting for one. Seeing none. With a vote of 34 ayes, 0 noes, 0 absent, 1 excused, House Bill 1124 is passed. Doesn't that feel good, y'all? Feels great. Co-sponsors. We have one, Senator Amabile. Senator Judah, Cutter, Ball, Exum, please add the president. Mr. Schaffler, please read the title of House Bill 1109.
House Bill 1109 by Representatives McCormick and Brown and Senators Weissman and Wallace concerning the designation of a decedent's gender identity on the decedent's certificate of death.
Senator Wallace? Senator Wiseman.
Thank you, Mr. President. We move for the adoption of House Bill 1109 on third reading and final passage.
Senator Wallace.
Wonderful. Good morning, all. Just to close out the conversation from yesterday, this is simple legislation that will help bring death certificates in line with other state of Colorado documents and help us uplift families and loved ones as they mourn those who have passed.
No discussion, no questions for the senator for Longmont. Seeing no further discussion, the motion is the passage of House Bill 1109. Are there any no votes? What? Mr. Minority Leader, Pelton B. Kirkmeyer, Simpson, Bright, Frizzell, Carson, Pelton R. Catlin, Liston, Baisley, Rich. With a vote of 22 ayes, 12 noes, 0 absent, 1 excused, House Bill 1109 is passed. Co-sponsors for the senator from Longmont's first bill: Bridges, Colker, Snyder, Sullivan, Mr. Majority Leader, Cutter, Kipp, Henriksen, Winter, Michelson Janae, Mabile, Gonzalez. Please add the president. Mr. Schaffler, please read the title of House Bill 1137.
House Bill 1137 by Representatives Lindsay and Velasco and Senator Winter concerning money from the Colorado Adopt-A-Shelter pet account used for the care of community cats.
Senator Winter.
Thank you, Mr. President. I move for the third reading and final passage of House Bill 1137.
Any further discussion? What a perfect bill. The president will find himself $1. Are there any no votes? Mr. Minority Leader, Pelton B. Roberts, Carson, Liston, Baisley, Rich, Kirkmeyer, Kipp. With a vote of 25 ayes, 9 noes, 0 absent, 1 excused, House Bill 1137 is passed. Co-sponsors: Senators Michelson Janae, Cutter. After all that, please add the president. General orders. Second reading of bills. Senator Exum.
Good morning, Mr. President. Thank you. I move that the Senate resolve itself in Committee of the Whole for consideration of general orders, second reading of bills.
You've heard the motion. All those in favor say aye. Opposed, no. Yet and still, the ayes have it. The motion is adopted. The Senate will resolve itself into the Committee of the Whole for consideration of general orders, second reading of bills, and Senator Exum will take the chair. Get you some.
Baby. The committee will come to order, and the court rule is relaxed for everyone in the chamber. Mr. Schaffner, please read the title to Senate Bill 152.
Senate Bill 152 by Senators Frizzell and Michelson Janae concerning requirements for healthcare practitioner identification.
Senator Frizzell.
Thank you, Mr. Chair. I would like to move the Health and Human Services Committee report.
And the bill?
And, and the bill.
Okay. To the Health and Human Services report. Senator Frizzell.
Thank you, Mr. Chair. So, members, in the Health and Human Services Committee, we offered a number of amendments to this bill based on a great deal of stakeholding that occurred to bring all parties all together, happily holding hands and in agreement, to the point that we actually, this bill was voted out of committee unanimously. So I was really happy about that. So some of those amendments, some of the things those amendments did was it removed requirements that the state-issued license, certificate, or registration appear on a healthcare practitioner's name tag. We did away with that. We did stipulate that at first contact only with a patient, the practitioner would verbally communicate their state-issued license, certificate, or registration, and just made, again, so that we wouldn't be driving patients crazy when a healthcare provider entered the room over and over and over again of a patient that it was just a good make sense thing. So I would, however, like to offer an amendment to the committee report at this point in time.
There's an amendment at the desk. No.
So,
Okay. Senator Frizzell.
I would like to, with that, move amendment L003 to Senate Bill 152.
Okay. We need to adopt the committee report first. So is there any further discussion on the committee report to Senate Bill 152? Seeing none, the question before us is the adoption of the committee report to Senate Bill 152. All those in favor say aye.
Aye.
All opposed say no. The ayes have it. The committee report is adopted. There's an amendment at the desk. Mr. Schaffner, please read Amendment L003.
Amendment L003, amend the Health and Human Services Committee report dated
Senator
March.
Frizzell.
Thank you, Mr. Chair. This amendment was also brought through a little further stakeholding and also some interaction with the committee itself. And so, and I'll go into deeper detail with the bill, but part of the bill requires identification for a very specific set of facilities: general hospitals, urgent cares, freestanding emergency room, freestanding emergency departments, and this Amendment 1 adds ambulatory surgical centers to that list. But the other thing that I think is really important, and I'm really happy to add this to the bill, is that in that verbal communication with a patient on, "Hi, my name is Dr. Smith," that this amendment also really inserts that unless emergent circumstances make it impracticable, and I had to learn what that word actually meant, and thank heavens for our nonpartisan legislative legal services staff who are word whizzes. So this is really important because you don't want to be in an emergency situation and tell your patient, "Sorry, you have to stop bleeding out because I have to introduce myself." So that just doesn't make sense. And so again, this is really going quite a ways towards making this a very common sense bill. So with that, I move L003 to Senate Bill 152 and ask for an aye vote.
Thank you. Is there any further discussion on Amendment L003? Seeing none, the question before us is the adoption of Amendment L003 to the Human Services Committee report. All those in favor say aye.
Aye.
All opposed say no. The ayes have it, and Amendment L003 is adopted. To the bill. Senator Frizzell.
Thank you, Mr. Chair. So I would really like to talk a little bit about this bill. It's a great bill. This actually came from the Colorado Medical Society and some concerns that they have around. We have great medical options here in the state of Colorado from a certification standpoint. We have expanded scope of care so that we have all sorts of different folks providing great care to the citizens of Colorado, whether you're a nurse practitioner or a CNA, a certified nursing assistant, which is what my niece is. I have my daughter-in-law is an ER nurse studying to be a nurse practitioner, and we have all of these different people who can make up an amazing and strong team. But as a patient, and I've learned this in my recent health struggles myself, is that people are not always, practitioners are not always, they may not always be forthcoming in what their certification is, and it's not out of malice or ill intent or anything. I just think that we get rather comfortable in our roles and we don't think about it. And so it's really important that you understand who is coming in the room to assist you, especially if you are in a hospital, urgent care, emergency room situation where you don't know those people. This is completely different from if you make an appointment with your dermatologist who you've seen for 5 years, or your eye doctor, or your chiropractor. You know those people, and so that's not really part of this. This has to do with making sure that you understand the credentials of the people who are serving you. This is about patient, it's about transparency, and it's about helping patients understand those who are giving them the great care that they're going to get.
Senator Michelson Janae.
Thank you, Mr. Chair. I'll just add that it's my honor to work on this with Senator Frizzell, who did the yeoman's work on this bill, and I ask for your aye vote.
Thank you. Is there any further discussion on Senate Bill 152? Seeing none, the question before us is the adoption of Senate Bill 152. All those in favor say aye.
Aye.
All opposed say no. The ayes have it. Senate Bill 152 is adopted. Mr. Majority Leader.
Thank you, Mr. Chair. I move the committee rise and report.
Thank you. Is there any objection to rising and reporting? Seeing none, the committee will rise and report.
The Senate will come to order. Senator Exum.
Thank you, Madam President. The committee has met and had a bill under consideration. Will the clerk please read the report?
March 26, 2025. Madam President, your Committee of the Whole begs leave to report it has had under consideration the following attached bills, being the second reading thereof, and makes the following recommendations thereon. Senate Bill 152, as amended, passed on second reading and ordered engrossed and placed on the calendar for third reading and final passage.
Senator Exum.
Thank you, Madam President. I move the report.
The motion is the adoption of the Committee of the Whole report. Are there any no votes? With a vote of 34 ayes, 0 no, 0 absent, 1 excused, the Committee of the Whole report is adopted. Senate Bill 25-152, as amended, passed on second reading and ordered engrossed and placed on the calendar for third reading and final passage. Consideration of House amendments to Senate bills. Will the clerk please read the title to Senate Bill 67?
Senate Bill 67 by Senators Simpson and Roberts and Representatives Martinez and Winter concerning changes to the Prosecution Fellowship Program.
Senator Simpson.
Thank you, Madam President. As much as it concerns me, I move that we concur with the amendments offered by the House universally.
Will you please explain yourself?
I'm not sure I can, Madam President, but thank you. In its infinite wisdom, once again, the House has stepped up to really protect the integrity of the judicial system and avoid the potential of rogue attorneys participating in the program. They've done this by adding 2 words to who's eligible to participate in the fellowship program. They have to be graduate from a regionally accredited law school in Colorado, not an uncredited regionally located law school in Colorado. That's, Madam President, why the necessity to concur.
Is there any
protect the
discussion?
system.
Senator Lundin, Mr. Minority Leader.
Thank you very much, Madam President. I'm just curious if rogue attorney is an oxymoron or a truism.
Is there any further discussion? The motion is that the Senate concur with the House amendments to Senate Bill 67. Are there any no votes? With a vote of 34 ayes, 0 no, 0 absent, and 1 excused, the motion is adopted. Senator Simpson.
Thank you, Madam President. I move for the repassage of Senate Bill 067, once again with universal support.
The motion is the repassage of Senate Bill 67. Are there any no votes? With a vote of 34 ayes, 0 no, 0 absent, and 1 excused, Senate Bill 67 is repassed. Co-sponsors. Senator Catlin. Announcements. Senator Judah.
Thank you, Madam President. I ask for a moment of personal privilege.
Granted.
Thank you. Members, today is Epilepsy Awareness Day, and in Colorado, the Epilepsy Foundation and Wyoming estimates that 65,000 people across both states are living with epilepsy. While the exact number for Colorado alone isn't specified, applying national prevalence data suggests that around 50,000 adults in Colorado may be affected. Nationally, 1 in 26 people will develop epilepsy in their lifetime. In a chamber like ours with just 35 members, that means statistically over 75% of us could be touched by epilepsy, whether personally or through a loved one. And I'm not suggesting that 75% of us will develop epilepsy, but it is a sobering reflection of how common an invisible condition can be. And because seizures can happen at any time, I want to share what to do if someone does have a seizure. First, stay with the person and start timing the seizure. Use rescue medication. I've been very public about my epilepsy. These are my rescue medications. You dispense and spray one nasal spray in each nasal, and it immediately stops my seizures. You keep them safe, move harmful objects out of the way, do not put anything in their mouth, do not restrain them, and if they are not awake, gently turn them on their side. But most importantly, stay with them until they are awake or alert. And perhaps just as important, respect their privacy. Seizures are scary, and for the person having it and for those around them. Certainly, creating space, allowing for dignity, and offering calm support makes a tremendous difference. Last year, I experienced an epileptic event in the Capitol, and the first to step in was former Senator Gardner. Members of the House and members of the lobby and our staff all responded quickly and calmly because we had a plan. And I'll always be grateful to the senator from Arvada, who stayed with me at the hospital and yelled at the paramedics for not letting her ride in the ambulance with her and said, "I have to go with her, I'm her best friend." And so, always, yeah, got you. And I also want to thank our incredible sergeants, as well as the senators from Aurora, Frisco, Thornton, and Madam President, yourself, for making me feel safe and for always knowing what to do if I ever have a seizure. So today, if you do know someone living with a seizure disorder, check in on them and ask how you can be more prepared and help them. A little understanding can go a very, very long way. And if you ever have questions about epilepsy or any seizure disorder, how to be safe, or just what to do, please ask. In my mind, there is no such thing as a stupid question, and when it comes to keeping everyone safe for our health and our safety, I'm always open to those questions. So thank you very much. Thanks.
Thank you for that very important announcement.
Thanks.
Senator Baisley.
Thank you, Madam President. I asked for a moment of personal privilege.
Granted.
Members, I want to report what I believe to be a violation of the Senate floor rules of placing something on a member's desk without permission. And these sunglasses and this pen were left on my desk in total violation of the rules. And I don't know who they belong to, but someone was evidently having a conversation in front of my desk. I've not. So, so I will place them inappropriately on the desk up over here for the owner to come retrieve. Thank you, Madam President.
All righty. Senator Mullica.
Don't know how you follow that up.
I don't know.
Thank you, Madam President. Members, Senate Health and Human Services Committee will be meeting 15 minutes upon adjournment to hear House Bill 1087 and Senate Bill 166 in the old Supreme Court.
Senator Exum.
Thank you, Madam President. Senate Local Government and Housing Committee will meeting 15 minutes upon adjournment to hear House Bill 1247, Senator Roberts and Senator Simpson.
Senator Kolker.
Thank you, Madam President. Senate Education Committee will be meeting at 1:30 today. We have 4 bills. We're going to be changing the order. We'll be hearing bills 1152 and 1135 first. Thank you.
Senator Winter.
Thank you, Madam President. Members of Transportation and Energy, we will be meeting at 1:30 today to hear 5 bills, 1161, 127, 1230, 1234, and 1280.
Senator Gonzalez.
Thank you. Colleagues, members of the Senate Judiciary Committee, we will be meeting today at 1:30. We will be switching the order of the 2 bills, though, on the calendar. We'll begin with Senate Bill 190, and then we will take up Senate Bill 189 for action only. Thank you very much. See you then.
Further announcements. Introduction of resolutions. Will the clerk please read the title of SR 008?
Senate Resolution 008 by Senators Cutter and Wallace concerning the designation of March 31st, 2025 as Transgender Day of Visibility in Colorado, and in connection therewith acknowledging the countless contributions that transgender people have made in history and to contemporary society, and committing to defend the rights of transgender people.
Majority Leader Rodriguez.
Thank you, Madam President. I move that Senate Resolution 008 lay over until Monday, March 31st, 2025.
The motion is to lay over Senate Resolution 008 to Monday, March 31st, 2025. All those in favor say aye.
Aye.
Opposed, no. The ayes have it. SR 008 will lay over until Monday, March 31st, 2025. Mr. Majority Leader.
Announcements.
Announcements.
Thank you, Madam President. I move that the Senate adjourn until Thursday, March the 27th, 9 a.m., 2025.
You have heard the motion. All those in favor say aye. Those opposed, no. The ayes have it, and the Senate will stand in adjournment until Thursday, March 27th at 9 a.m.